let's move to, again, that, we talked about the Kaiser model, and we know a lot of people who've moved into the health plan, hospital health plan kind of model. So is that the idea? Kind of going back to that. Everybody, I remember, on Wall Street, I don't know, like 5 or 6 years ago, everybody was like, copy Kaiser, that's the way to go. And you watched everybody get into health plans. And so how's that working out right now?
Kaiser has an interesting model. And if you're in California and been there for 60 years, you have a good chance of probably proof of concept, right. But it doesn't necessarily translate to other markets. We heard Geisinger was the answer because they had their own health plan, and their health plans, and that organization's losing tens of millions of dollars, if not hundreds of millions of dollars, and then eventually sold to Kaiser. So when you look at the actual data, and if you look at this slide, what you see is that as far as Medicare Advantage goes, the market share for the for-profit Medicare Advantage plans has increased dramatically since 2019. At the same time, there's been no material increase by the Blues or the not-for-profits, meaning that which would be either Kaiser or the Payviders. Those are the not-for-profits.
Yeah.
And a good percentage of the gray graph is actually Kaiser. And so there's no evidence a provider getting into the Medicare Advantage business can have a material impact globally. Now, we may find pockets in certain places, but generally speaking, as you can see, their market share has not increased materially over the last 5 or so years. And if you look at the right-hand side, at the bottom, you can see that the for-profits, the top 5 for-profit MA plans, have generated profits of 6.6% going down in 2021 to 4.9. But I just want to make the point that it's going to go down even further. Humana lost $500 million in a recent quarter. At the same time, all the rest of the plans, they basically have a negative margin at this point in time for Medicare Advantage. And just a note on the commercial side, because I hear this, I've had a hospital call me up and say, we have a bunch of people saying we need to do direct contracting. Well, my first question is, how well do you do direct contracting with yourself? For example, if you're your own employer health system, do you have the most efficient health plan possible just for your own employees? And if you don't, get to work on that. The commercial insurance business is not a good business. Even the top 5 have seen about a 50% decline in their margin. And the rest of the people in the business are operating essentially at break even. So again, when you get advice, take a look at a P&L statement without heroics to make sure that this makes sense. It baffles me why people are advising others to get into the health plan business. We have a fairly close health system that we work with that just terminated their 30,000 capitated lives because they claimed they were losing, I believe it was in the range of $75 million. And one of the main reasons they did that is they said, it's not the hospital, but our doctors just couldn't operate in a culture of risk and a culture of fee-for-service. We had to pick one or the other. And so that's why they got out of the business. So the evidence is fairly clear. And again, it baffles me why so many folks want to get into that business.